A very good evening and welcome to the session on the very important topic, which is tips for coping with anxiety during pregnancy and post delivery, which is one of the most important topic for women as they suffer so much with anxiety and so many emotions pre and post the pregnancy. So we welcome our doctor for today, Dr. Joshita Nayak from Apollo Cradle and Children's Hospital Jayanagar to enlighten us on the topic and to share some amazing details and facts about the same. I request all my viewers to just, if you have any doubts, any queries, if you want to talk to the doctor about anything, please drop a comment and we'll take all your comments by the last of the session. If not, then later. But stay tuned till the last because the doctors will be sharing all the questions and queries by the last. Doctor, you have the stage now.
Thanks, Nikita. So, good evening, one and all. I'm Dr. Joshita Naik, consultant obstetrician at Apollo Cradle Jayanagar. So, we are here to discuss an important but less often spoken topic that is about anxiety and how to deal with anxiety during pregnancy and post childbirth. So, like all of us understand that anxiety is a common phenomenon which all of us go through at some point in time. Rather, it is a normal reflex that individuals are to deal with. But sometimes this anxiety or the worries that go on do affect our lifestyle and do affect our well being. That is when it becomes a concern and it needs to be addressed. So, we are going to deal about anxiety, which women can experience during pregnancy, during the process of childbirth, or following childbirth. So, anxiety disorders can be affecting individuals, either the mothers or the couple as such. So either parent can be going through the anxiety when a woman is pregnant. So I would broadly speak on anxiety during pregnancy with respect to anxiety that happens during the 9 months of the pregnancy that the woman goes through, which we broadly classify as antenatal anxiety. Then there can be a specific anxiety or a worry that troubles the mother with respect to the childbirth or the process of the labor and delivery as such. Or there could be anxiety that the woman is concerned how she is going to deal with during the postpartum period, or as to how she is going to take care of the newborn. So, coming to antenatal anxiety, this is very common scenario that we encounter during our OPD practice, wherein individuals, either the mother or her spouse, do come in with a lot of concerns. So how do we exactly say that this is a normal phenomenon, or whether they are going through anxiety during pregnancy? So certain things, it's a little difficult to completely say that this is normal versus this is anxiety, but there are certain tips to understand that are you really going through anxiety or this is a normal phenomenon. So coming on to who are actually more susceptible to anxiety. So women who have had a past history of an anxiety disorder, who've been on certain medications earlier, like they've been on medications to treat depression or anxiety during their earlier phase of life, these women can go through the anxiety issues during pregnancy. If the mother is pregnant for the first time, usually primi gravidas, or the mothers who are pregnant in their first uh, pregnancy, do go through a lot of anxiety related issues. Certain women who have had a previous traumatic pregnancy, as in when they have had previous history of miscarriages, or a previous traumatic birth, or a previous loss of baby, or previous babies having anomalies, these individuals are again more susceptible for anxiety related disorders. So, coming on to how do we identify? So, symptoms sometimes the smallest or the trivial of the symptoms can cause very aggravated reactions in the woman. So, that again becomes a concern that individuals start worrying about simple things like am I doing this right? Am I eating the right thing? Am I supposed to walk? Am I supposed to do this, do that? So there are multiple questions running in the mind of a woman. So when you start worrying more than required, when it is actually impacting your well-being, when it is impacting your health, when it's impacting your sleep and your regular routine, that is when we would say that you are going through anxiety. Or when you start worrying and always keep seeking reassurance about your health, or more often your baby's well-being, for there are multiple visits to the clinic saying that there is anxiety. Is my baby doing well? Am I doing well? Do I have any concerns? So this is when we kind of are concerned that the woman is going through anxiety during pregnancy. So is it important to actually identify these individuals who are going through this phase? I would say yes, definitely yes, because we need to address their problem. We need to give them help, and we need to help them go through this phase, because like all of you know that pregnancy and postpartum is always controlled is under the control of a lot of hormones. So these hormones as such make women more vulnerable, more susceptible to anxiety related issues. So if we are not going to understand and help them out with these symptoms, they may be pushed to the edge, which we do not want them to go through. They may have panic attacks, they may have episodes of breakdown, where they would need much more help to come out of those kind of issues. So it is important to identify when a woman is going through stress or anxiety which is beyond uh, you know uh, which is really impacting their lifestyle. So, coming on to when we identify an individual, we have to give them the appropriate guidance. The next ep- episode where a woman may experience anxiety is during the process of childbirth. So, again, if a woman has had a previous traumatic delivery or a difficult delivery, or certain individuals are extremely apprehensive about the pain or the anxiety of entering the uh, operative room during the delivery, then these individuals need to be addressed much beforehand, much before they go through the process of labor and delivery. So, here again, being aware of and having adequate knowledge about what is going to happen during the process of labor and childbirth is very, very important. Here, there is a definite role of guiding them through the birthing classes. So, during the birthing classes, during the antenatal classes, which most of our centers do conduct, it is very, very important, because individuals are actually given a lot of information, and they are actually guided through what is exactly the process of labor, and how they would go through, and how they would have trained birth assistants who guide them through the procedure. So knowledge again is very, very important to allay the anxiety. Then, coming on to the more common phase, of course, antenatal anxiety is a concern, but postpartum or post delivery anxiety is which most individuals, it's as high as almost 50% of individuals do go through this phase of anxiety. Here, this is a lot contributed to the hormonal changes which happen immediately post delivery. So we can basically broadly classify it into postpartum blues versus postpartum depression, which is a more severe form. So a lot of feeling of, through the 9 months, the woman would have been really pampered, and she would have been, really cared for. Suddenly, the entire focus is on the baby, and then she does. Sometimes the mother do feel a sense of neglect, and they are kind of overwhelmed with the odd hours that they have to keep feeding the baby. There is lack of sleep. So all these multiple factors can lead to postpartum blues or postpartum anxiety. There is a lot of thought as to, am I doing the right thing for my baby? Is this the way? Am I producing adequate milk? Am I taking care of my newborn in the right way? A lot of this, I would say, is associated with trying to be perfect, which is not really required. So you are doing your best, you should be feeling good about it. So when we have actually identified that, okay, these are the scenarios which are the problem areas, how do we deal with anxiety during pregnancy? So first and foremost, I would say, is Identify that you are going through a stress. Unless you come up and you express yourself or you talk to a person, you will never be able to seek help. So, the first and foremost point I would say is identify that you need help. Second thing is discuss your problems with a partner. It could either be your spouse or a close friend or your healthcare provider, your doctor, somebody who is giving you positive vibes. It shouldn't be somebody who makes you feel worse and who just kind of puts your problem away. That is not what we are looking for. We need help. So we should be identifying the right individual whom we feel can sail us through this. Third thing is do give importance to self care. So, self care, self love is something that is very important. Do not compare your pregnancy to what your sister would have had, your mother would have had, or your granny, your aunties. So there in usually in our scenario we have a lot of advices which come in during the pregnancy. Do this, do that, don't do this, don't do that. I'm not saying do not take advice from people, but yes, do understand what is good for you and what makes you feel better. So you are the best person to understand what actually works for you. It's important to think rationally when you are actually dealing with any scenario. So sometimes it just becomes important for us to really think whether a lot of questions come on with diet. Should I eat this? Should I eat that? Can I eat this? So just think rationally. When you've been given a chart and when you've been guided by a professional, just stick to it and just follow that. You don't have to be overly cautious or overly anxious as to are you doing the right thing or not. So, self care, self love, and learning to respect yourself, your body, and your mental well being is very, very important. Third thing is when the next step I would say is seek professional help. So, when you feel that this anxiety is getting way beyond your control, when it is impacting your regular well being, do talk to your healthcare provider. So, initial sessions of counseling and couple of suggestions definitely will come across from your obstetrician, and they would be able to suggest a lot of ways of relaxing or calming you down. A lot of importance is given to mindfulness, that is relaxing your mind and thinking about the situation in a calm manner. There is also a role of what we call as cognitive behavioral therapy, wherein we try to remove the negative thoughts and try to reinforce positive thoughts so that you don't keep pondering over the negative thoughts over and over again. So if you are not able to do it yourself, it's always important to take help uh, of a trained person who can actually help you go through this. A lot of importance is given to breathing and yoga during pregnancy for the same reason. So, when you enroll yourself early for these birthing classes, you are taken through the journey of all these things. It not only includes your exercises or your overall diet, it also includes your mental well being. Because an individual will do good only, it's not only about the physical well being that we are looking at in pregnancy, it's also the mental and the emotional well being that we want, because the 9 months that you go through should be a very happy and a very fruitful journey. We don't want you to feel anxious and low or overwhelmed with the entire journey through the 9 months. So you should be able to deal with certain stressful situations. Now you should be willing to accept certain stressful situations that can arise during pregnancy. Like sometimes your obstetrician may be giving you certain you undergo an ultrasound scan, there may be some new findings, or there may be some concerns that your baby can have certain issues, like some kind of scenarios where we explain that you have some concerns on growth restriction or low fluid. So you should be willing to accept these situations and listen to the obstetrician and react appropriately. See, all of us are anxious when it comes to the well being of ourselves, and more so with the well being of our baby. But reacting overly and above it can actually cause a negative impact, because studies have shown that uh, antenatal anxiety can be associated with low birth weights or even with early deliveries. So, we do not want to push you to those scenarios which can easily be avoided. So, when you seek help, when you get the correct professional guidance, and when you are actually looking at your physical, mental, and emotional well being, you can overcome a lot with this concern on anxiety during pregnancy. I hope these tips do encourage you to have a healthy lifestyle. I would say do not start at pregnancy. Please start having these kind of changes much before you plan your pregnancy, because none of us can change overnight. It's not that we fall pregnant and then the next day we look at having a complete change of lifestyle. So when you have a healthy lifestyle which includes healthy eating, proper exercise routine, and very importantly nowadays I would say is with the excessive use of gadgets, I would say sleep hygiene, which is very very important, which does make individuals very very susceptible to anxiety related disorders. So when you practice all this even before you fall pregnant, then your journey through the 9 months becomes much much easier, and you can deal with your pregnancy, your delivery, as well as your postpartum period much better. So practice self care and self love and take care of yourself. That helps to solve your problems. Thank you for a patient listening. If there are any questions, I'm always open to it. So I think we have no questions. So any questions can come up in the chat. Thank you so much.